Okay.
Okay, we are here today to try and demonstrate drawing arterial cord blood gases from the umbilical artery. Before you get started, you will need to make sure you have a blood gas draw kit, either a kit that has liquid heparin in it, or you may have a kit that has dry heparin in it. Either one will work. You also will need a good section of umbilical cord, and preferably if the cord is tense, as this one is, you'll be able to get a better draw. One of the things you need to be sure to do is make sure that you notify respiratory therapy and make sure that they are going to be available to run your blood gas. Once you draw your blood gas, it is good for 10 minutes in the syringe. If you leave it in the cord, if somebody is not available and you just leave the blood in the cord as it is good for 1 hour. And if you place the cord on ice, it's good for 3 to 4 hours. So you will need to make sure before you draw it into the syringe that there is somebody immediately available to run the test. In some situations, it may be the PCS who will do that for you. The first thing you need to remember when you actually start to draw is that you will be drawing from the artery, which is the small blood vessel. The large blood vessel is the vein. If you puncture the vein, the cord will become soft and you won't have the pressure necessary to actually get a good blood draw. And I am going to go ahead and use a syringe that has liquid heparin in it so that I can demonstrate how this works in regards to the use of the liquid heparin. If you use a dry heparin syringe, no special procedure. So if you're going to use a liquid heparin syringe, first thing you'll need to do is attach the needle cover. So I'm going to do that real quick. This needle cover prevents having to recap and therefore reducing injuries. So this will screw onto the syringe. And you'll make sure you get that in there tight. And then the next step is to attach the needle. So you will attach your needle. And then the next step is to remove all of the liquid heparin and the air from the syringe. For an adult blood draw, this amount of heparin is okay, but for neonatal, because we are only going to be drawing about a half a cc, you need to make sure that you get rid of all of the liquid heparin. So you squirt the liquid heparin out, and you're ready to draw. When you draw, you want to make sure that you don't put your fingers underneath the cord to support it when you're drawing, because you could puncture through the cord and into your finger, which would not be a good idea. The second thing is to make sure your bevel is up, and also you're going to be very shallow when you go into the artery because you don't want to poke through and get into the vein. Typically when you get into the artery, you'll see a little flashback at the site of puncture. So we're going to go ahead, and we have all our air and heparin out. I'm going to puncture the artery. There's our flashback, and we're going to try and draw about a half a cc if we can get it. And sometimes as you empty out the artery, it looks like there isn't any more in there, but if you just relax a second, it will refill, and you will actually get your specimen. Okay, so we have our specimen, and we're going to put the tip of this needle protector back on, tap out all the bubbles, and I am going to remove the needle, and I am going to attach my vented cap so that I can expel all of the air all the way up. Perfect. Once this is drawn, I've already notified RT. I will give them another call and let them know I have my specimen ready, and I will attach my label to it so that we know which mom this came from, because we don't have baby labels yet, and send it off for running through the iStat machine. The procedure is identical with the dry heparin syringe. You don't have to remove the heparin. Obviously it's powder, but you do need to remove all of the air from the syringe. And that's about it. Thanks so much.